Cushing's disease is a rare condition that affects about 2 in every 1 million people per year. Its cause? Excessive cortisol production arising from a pituitary tumour secreting the hormone ACTH. The disease typically afflicts adults between the ages of 20 to 50, and women account for the overwhelming majority, over 70% of cases. Tumours that cause Cushing's disease occur spontaneously, and the condition is not hereditary.
Excess levels of cortisol due to Cushing's disease clinically manifest in most body systems in a number of ways.
Cushing's disease affects general appearance by causing truncal obesity whilst keeping thin extremities, fat deposits on the back of the neck and shoulders known as the buffalo hump, and a rounding of the face, or moon face.
Regarding the integumentary system, it causes thin and fragile skins, purple striations, petechial hemorrhages, bruises, flushed cheeks, acne, and poor wound healing.
Cardiovascular symptoms include hypovolemia or fluid overload, hypertension, and edema of the lower extremities.
Gastrointestinally, there may be a change in secretion of pepsin and hydrochloric acid.
In the urinary system, there's a risk of glycosuria, hypercalciuria, or kidney stones.
In regards to the musculoskeletal system, there may be muscle wasting in extremities, proximal muscle and general weakness, fatigue, osteoporosis, or back and joint pain.
Cushing's can inhibit the immune response, suppress the allergic response, and also inhibit inflammation.
Hematologically, there may be leukocytosis, excess white blood cell count, lymphopenia, a low lymphocyte count, polycythemia, increased concentration of hemoglobin in the blood, or increased coagulability.
Common side effects on fluid and electrolytes include sodium and water retention, edema, and hyperkalemia, or potassium deficiency.
Metabolic symptoms may include hyperglycemia, negative nitrogen balance causing protein breakdown, or high cholesterol.
If the pituitary tumour causing Cushing's becomes quite large, it can compress the optic chiasm, causing loss of peripheral vision.
Finally, Cushing's can have some mental health symptoms. These include psychic stimulation, euphoria, irritability, depression, or hypomania.
This is Danielle. Danielle is a 26-year-old woman who leads a relatively normal and healthy lifestyle. Danielle has no significant medical history. She works full-time in the legal profession, prepares her meals weekly, and makes an effort to exercise 3 to 4 times per week. In the last 6 months, Danielle has noticed significant changes in her moods, appearance, and bodily functions, but she attributed these changes to side effects from a new contraceptive method she was trying. When Danielle ceased use of the contraceptive to see if symptoms would subside, they did not. In fact, they worsened, and other significant symptoms also manifested.
Danielle has presented to us with the following symptoms: high blood pressure, high glucose levels, fullness and rounding of the face, a buffalo hump or extra fat deposit on the back of her neck, weight gain in the abdominal region whilst her limbs have stayed thin, purple abdominal striations, moodiness and irritability, and peripheral loss of vision. On admission to ED, a full physical assessment was completed. However, Danielle was admitted to the ward for further tests due to abnormal findings. Danielle has presented to us with a number of symptoms that can easily be explained through the pathophysiology of Cushing's disease. In a person without Cushing's disease, the hypothalamus releases CRH, corticotropin-releasing hormone, to the anterior pituitary gland, causing the release of ACTH, or adrenocorticotropic hormone. ATCH then triggers the adrenal glands to secrete cortisol in the body. Once a high level of cortisol is reached, a negative feedback system works to stop the hypothalamus secreting CRH. In Cushing's disease, this mechanism is still working. However, an additional tumour on the anterior pituitary releases excess ACTH, causing excess amounts of cortisol. This tumour does not react to the negative feedback loop, and hence does not stop the secretion of ACTH. Danielle's symptoms can be explained through the prolonged effect of excess cortisol in the body. Cortisol is a hormone that is related to our stress response. It increases heart rate, blood pressure, blood glucose levels, promotes fat, protein, and carbohydrate metabolism, inhibits the immune response. The symptoms usually disappear once the stress is over. However, in Cushing's, cortisol is continually produced. Over a long period of time, this continuous production can have a huge effect on the body. Danielle's high blood pressure can be explained from sodium and water retention in the body. This retention causes hypervolemia and leads to an increase in resistance in the blood vessels, thus causing a higher blood pressure. The high blood glucose level in Danielle's blood are caused by the body breaking down carbohydrates and fats in preparation for stress. When there is excess cortisol, the body then creates extra fat deposits and from dietary intake in preparation for future situations. These fat deposits are on Danielle's neck, abdomen, and face. Danielle has also experienced purple abdominal striations. These are caused from a combination of rapid abdominal weight gain and the effect of cortisol on blood vessels. Cortisol causes a decrease in collagen levels in the superficial small blood vessels and capillaries. This means that when minimal trauma, such as stretching, is applied to these vessels, they will burst, causing a bruise-like stripe on the body. The stripes, along with rapid weight gain, can cause moodiness and irritability due to the patient's body image and common fatigue. Finally, Danielle's peripheral vision loss can be explained by the tumour on her pituitary gland, as this is the primary reason that Danielle has come to the emergency department. It is evidently caused by something that has recently changed. In Cushing's disease, the pituitary tumour can continue to grow until treatment is sought. In Danielle, the tumour has grown so large that it has started to compress the optic chiasm, resulting in peripheral vision loss.
If Danielle did not present to the emergency department and continued to live with her symptoms, there are a number of serious complications that may have occurred. A combination of the hypertension and excess work of the adrenal glands, located on the top of the kidneys, could lead to acute renal failure in Danielle. As the kidneys are vital in excretion and maintenance of electrolytes and body pH, Danielle could develop end-stage renal disease, which is a life-threatening condition. Prolonged hypertension could also result in congestive heart failure. Additional complications include further growth of the tumour, affecting other parts of the brain or resulting in complete vision loss. Danielle may also develop diabetes mellitus from uncontrolled glucose levels.
Danielle was admitted to the ward for further tests such as urine and saliva, MRI and CT of the pituitary and adrenal glands to look for tumours, and the dexamethasone blood tests. These look at levels of cortisol and they will stay high if the person is positive for Cushing's. Medical practitioners confirmed Cushing's in Danielle.
In cases of Cushing's, treatments are designed to lower the levels of cortisol in the blood. At times, this can be achieved by simply discontinuing the use of exogenous corticosteroid medications or by altering dosages. With a case such as Danielle's, however, where the cause of her Cushing's disease is a tumour on the pituitary gland, radiation therapy or transsphenoidal resection or tumour removal surgery are usually recommended. The downside to these treatments is that they are not always possible and are not always effective. There is currently only one specific drug on the market to help those suffering from Cushing's disease. Other medications are used predominantly to treat the acute symptoms the disease can cause. When it comes to pharmacological interventions, it is important to apply the National Safety and Quality Health Service Standard 4 for medication safety. This includes being very vigilant and adhering to the 7 rights of medication administration. They include ensuring you have the right patient, that they are being administered the right medication and the right dose at the right time and for the right reason, and finally, that the right documentation has been completed. This process and the NSQHS Standard 4 are in place to reduce risk and ensure safety in medication administration.
Pasireotide, or Signa-4, is a somatostatin analogue drug used in the treatment of Cushing disease when surgery or other interventions are not an option or are ineffective at reducing ACTH levels because of the pituitary adenoma. The indication for the use of this drug is the treatment of Cushing's disease. The drug works at reducing the levels of certain hormones produced in the body. In this case, it works to decrease the production of ATCH in the pituitary gland, which in turn inhibits the production of cortisol in the adrenal gland. It is contraindicated by diabetes, liver disease, a heart rhythm disorder, personal or family history of long QT syndrome, gallbladder disease, or a history of electrolyte imbalance, such as low levels of potassium. The side effects include feeling weak or tired, nausea, stomach pain, diarrhea, headaches, swelling, bloated feeling, cold symptoms such as a stuffy nose, sneezing or sore throat, hair loss, or pain, redness, itching, bruising, or bleeding where the medication was injected. It is important to monitor for potential side effects, ensuring the patient does not exhibit any contraindications throughout the use of this drug. This would entail monitoring BGL levels, heart and liver function, and electrolyte level. The second drug that Danielle may be prescribed to is spironolactone. This drug is a diuretic indicated by edema and hypertension. The action of this drug is it is an antagonist of aldosterone, acting primarily through competitive bindings of receptor at the aldosterone-dependent sodium-potassium exchange site in the distal convoluted renal tube. This causes an increase of sodium and water to be excreted, while potassium is retained. It acts as both a diuretic and an hypertensive agent. This drug is contraindicated by acute renal insufficiency, Addison's disease, hyperkalemia, pregnancy, hypersensitivity to spironolactone, or the use of epinephrine. The side effects include polyuria, dry mouth and thirst, breast pain in women, growth of breast tissue in men, irregular menstrual periods and vaginal bleeding, erectile dysfunction, drowsiness, tiredness, and restlessness. It is important to monitor for hyperkalemia, hyponatremia, hypochloremia, headache, nausea, weakness, and vomiting when using this drug. Most of the nursing interventions surrounding Cushing disease are based on patient education, as the multifaceted symptoms of the disease need to be managed by the patient over a long period of time. Education is an important theme throughout the following nursing interventions.
It is important to conduct regular physical assessments of the patient, and in particular to monitor the specific symptoms that are affecting her health currently. In particular, Danielle's heart rate and blood pressure. Cushing's disease can cause high blood pressure due to expanded fluid volume with sodium retention and subsequent edema, which is characteristic of the illness. Danielle has been prescribed a diuretic in order to manage this symptom. It is therefore important to regularly take her blood pressure and monitor for any major changes. Evidence of hyper or hypotension could indicate discrepancies in Danielle's medication dosage or other underlying causes. It is also important to look out for any cardiac dysrhythmia. Because Danielle is taking spironolactone, a potassium-retaining diuretic, there is a possibility she will develop hyperkalemia, which is a known cause of cardiac dysrhythmia. Edema. Intermittent observation of swelling and water retention levels in Danielle's limbs is necessary to track the effectiveness of her prescribed diuretic. Finally, because Danielle's tumour is located at the base of her brain in the pituitary gland, and because she has experienced peripheral vision loss due to the location of the tumour, neurological observations are essential. A neuroassessment would include completing a Glasgow Coma Scale to assess for any impairment of her conscious level, the Pearl Pupil Assessment to assess a number of brain functions, and a visual acuity test.
Danielle has been prescribed spironolactone, a potassium-sparing diuretic. Because of this, it is important for her to maintain electrolyte balance in the body. There are a number of ways to obtain, monitor, and correct this balance that the nurse can initiate in their care. Firstly, the nurse should encourage Danielle to have a low-sodium diet. This can help control the development of fluid retention and hypokalemia. Additionally, she needs to reduce her fluid intake to prevent circulatory overload. The nurse needs to monitor Danielle's fluid through the use of a fluid balance chart. This can help monitor the fluid retention of her body and to see if the correct dose and type of diuretic has been prescribed. Finally, Danielle needs to have regular blood tests. This is to ensure that her electrolytes are in balance. If they do not balance, infusion of electrolytes can be ordered and her drugs can be changed. If Danielle's electrolytes stay out of balance, this can have serious consequences such as dehydration and cardiac arrhythmias.
Because of the rapid changes in Danielle's appearance due to the symptoms of Cushing's disease, it is imperative for the nurse to provide an atmosphere of acceptance and positive caring. By checking in with her and encouraging her to express any feelings she has about her body image and general mental health, may facilitate a quicker adjustment to the changes caused by the illness. The nurse should reassure Danielle that the physical changes she has experienced are a result of elevated hormone levels and they are likely to resolve when the hormone levels return to normal. This will help her to develop realistic expectations about the changes and may enhance her willingness to take part in recommended treatments. In addition, the nurse may promote specific coping mechanisms or refer Danielle to local support groups so she meets people who have experienced similar situations and learn coping methods that help to enhance her self-esteem.
As Cushing disease causes a breakdown in superficial blood vessels and increases the blood glucose, wound healing may be difficult. For this reason, the nurse needs to be vigilant in complying to the NSQHS Standard 8, preventing and managing pressure injuries. If Danielle was to obtain a pressure injury, it would be difficult for her body to heal this. This is because Danielle is more prone to tears and hematomas. The rapid weight gain causes fragile skin, and impaired protein synthesis and hypoglycemia prevents proper wound healing. To combat this, Danielle needs to have adequate cushioning available for pressure-prone areas such as ankles, bottoms, and hands, and needs to be moved or repositioned carefully every 1 to 2 hours. Additionally, the nurse needs to complete daily skin checks, and if any wounds start to appear, to care for these effectively.